Dan Williams, Survive Outdoors. If you're new to the channel, what we do primarily are wilderness medicine videos, how to prep you to go in the outdoors. We teach you what to do if you get hurt, and we do some gear reviews on here. If you like that, then join, subscribe. It would be awesome. So I am board certified as a physician assistant. I also have a doctorate in clinical psychology. I specialize in forensic psychology. Been doing wilderness medicine for about 25 years, and I've been doing urgent care medicine off and on for 40 some odd years. So what today is, we are going to run down different medications that I feel is important for you to have in case there is the grid goes down, some major catastrophe. So we're going to start out with over-the-counter meds. And what would I suggest for over-the-counter meds with a few little hints and tricks thrown in? So right off the bat, we're going to talk about ibuprofen and Tylenol. So with ibuprofen, I'm going to show some studies here in a minute. I'm going to throw them up that about less than 5 years ago, they came up with 2 or 3 different very well-rounded studies that 800 milligrams of ibuprofen, which is prescription strength, does no more to alleviate pain than 400 milligrams. And basically you have less gastric irritation. There are still times when I suggest to some of my patients to take 600 milligrams, but I haven't prescribed 800 milligrams of ibuprofen in at least 2 years. So that's kind of important to note. So ibuprofen comes in 200 milligram tablets or capsules. There is no great evidence that shows that a capsule gets more absorbed quickly than a tablet. The maximum amount for an adult that you can take in a given 24 hours is 3,200 milligrams of ibuprofen, and with Tylenol it's about 3 to 4 grams a day. Now they work in different pathways, so if you're in the outdoors and you have a sprained ankle or you get hurt, then really important to know you can take both of these at the exact same time. It's also very safe for little ones. If they have an ear infection, you can't get the fever down. So aspirin, Tylenol and ibuprofen, those are some of the hallmarks of that. Ibuprofen is an anti-inflammatory and pain reducer. Tylenol is strictly a fever and pain reducer, does not have any anti-inflammatory effects whatsoever. Another one on the market is naproxen, which is Aleve. That's twice a day. That is harder on the gut, so just so you're aware. Some people swear by it. So those are 3 that I would say they're really easy to obtain. Well, suspension of ibuprofen Tylenol recently has been more difficult, but you have some time, get enough of it so you don't run out of that. Some great meds, and they're helpful. Aspirin. So with aspirin, as we've talked about in various videos, it is really the first line of treatment for if you're having a heart attack. It's a great pain reliever. It's a good blood thinner. However, you got to be cautious with it. A lot of people are allergic to aspirin, so that goes with anything on here that I'm talking about. If you have any allergies at all, be really careful with that. Side note, asthmatics with ibuprofen. Some asthmatics, ibuprofen will exacerbate an asthma attack, so word of caution on your ibuprofen. Antihistamines, there's a bunch. Before I go on with antihistamines, let me just briefly tell you one other advantage of aspirin. You can crush it up into a fine powder, 1 or 2 drops of water, make a paste. If you have a wart, make sure you just put that on the wart. That doesn't get on your skin because it will burn. And if you do that day in, day out for 3 to 4 weeks, you can get rid of your wart. Handy little trick to get rid of warts. All right, antihistamines. We've talked about them in a variety of videos, especially on wasp bee stings. On antihistamines, you have diphenhydramine, Benadryl, Allegra, Claritin, Zylol. There's a bunch out there. These are all over the counter. They're H1 blockers. They work fantastic. Some are more drowsy than others. So be aware of that. They will dry out your mucous membranes, but they work great in case you're having some type of allergic response. So yeah, always have some antihistamines on hand. In the same category of antihistamines are going to be meclizine and dramamine. Now these are for motion sickness. They're also for vertigo. They work really well. I just got in a discussion with the pharmacist. It was a little tense because I wanted this patient to specifically have meclizine. It's less drowsy than Dramamine, and he basically said, you don't need a prescription, just get it over the counter and you get Dramamine. So I had to call him up, and you need to know that meclizine takes about an hour to kick in. Dramamine takes a little less. Meclizine is less drowsy. It also goes by an over-the-counter name called Bonnie, B-O-N-N-I-E. Dramamine is more drowsy. So have those on hand also, because vertigo, it's just a terrible thing. You get nausea, you can throw up. It can be debilitating. So it's good to have that on hand. Eye drops. Get you some normal saline eye drops on hand, have those, and antihistamine eye drops over the counter are nice to have. I don't think Visine makes an antihistamine. Maybe they do by now. I'm not sure. Everybody's competing against each other. So, what else? The nose sprays. Antihistamine nose sprays and steroid nose sprays. So they have normal saline, also nose sprays. So have those on hand, and basically if you have someone in your family that suffers some severe allergic rhinitis and they're in the outdoors, it's nice to have those there. Also, it's beneficial if they have eustachian tube problems, fluid buildup in their ears, it's nice to have a nose spray that works. We also have talked about numerous times the Aspirin nose spray that has oxymetazoline in it, that is a vasoconstrictor. If you're going to use that for your nose, no more than 3 days. Really important, but it's nice to have for small cuts because it'll help stop the bleeding or at least slow it down. Steroid creams, hydrocortisone, hydrocort, have a steroid cream on hand. If you're in the summertime, bugs, it works fantastic for bug bites, great for short-term use of eczema. There's a lot of uses of a steroid cream, so it's nice to have that on hand. Remember, if you cover up the area of the rash after you use the cream, it makes the cream more potent because it cannot evaporate. You don't want to use steroid creams on the face. Important part that I need to bring up. Antifungal creams, clotrimazole, Lotrimin. No one likes jock itch, right? No one likes athlete's foot. So it's good to have an antifungal cream on hand. H2 blockers, Pepsid AC, that works fantastic for gastric acid. Also in combination, you get a bee sting, it works awesome with that. You can do your antihistamine like your Zyrtec, Allegra with your Pepsid AC, which is different than a PPI. A PPI is a proton pump inhibitor. And those are like omeprazole, which is Prilosec, Nexium. Your PPI will not do what Pepsid AC does. It basically inhibits the release of acid from your gut. So, know the difference. Now, the bad part of omeprazole and Nexium, do not take it long-term defined by more than 3 months, because it depletes calcium, which if you have a history of osteoarthritis or bone issues, not really good to have on hand. Let's go to the lower gut. You need to have in stock Dulcolax, Melcomagnesia, Imodium, kaopectate. It is just hard to function if you can't poop, all right? So if you get constipated, you get plugged up, it's nice to have those on hand. Kaopectate and Imodium are clearly for if you have diarrhea. Imodium, kind of in the opiate family. Got to be a little careful with that. No more than 4 tablets in 24 hours. Really important. It can cause heart arrhythmias. Yeah, if you take too much of it. You know, I've had this happen. People have diarrhea, they're on a mission from hell that they're going to stop their diarrhea any way, shape, or form. They're taking 2, 3 tablets at a time, and they come in and they don't know why they're fatigued, and they're basically have a heart arrhythmia, and it's jacked up to 140 beats a minute. And so be careful with the Imodium. As the box states, don't go crazy with it. As the box states on the Imodium. What else? Over-the-counter meds. Let me run down really a few things that I think are really important that are not over-the-counter meds, but you want to have available. An extra pair of glasses, extra contacts. If you have hearing aids, like this guy right here, make sure you have batteries. Be nice to have an extra set of hearing aids. Dentures, you want to have another set if you can afford those puppies. They're expensive. Remember on eye drops, you can take eye drops and use eye drops for ear infections. Ear drops can go in the ears. Ear drops don't go in the eyes. So it's a nice little thing to know, especially if you have an ear infection and you have some antibiotic eye drops. You can use those for your ears. So nice little gee whiz fact. Bandages. Make sure you have some non-stick bandages, and we've gone through bandages numerous times. All right, so now we're going to go into prescription meds, and I'm going to give you guys a couple companies where you can actually purchase meds from the company, and there actually are prescription. And we're going to talk about pricing and whether they're good or bad. So before I jump into prescription meds, let me just run through some basic bandages. There's 4x4 gauze, 2x2 gauze. They come in, obviously different dimensions. Then there's gauze wrap. There's Adaptic, which is a petroleum-based gauze, which is really nice. It's non-stick. Zuriform. You can find majority of these at any of your local stores. And then there's MediRip, or it's called Coban, C-O-B-A-N, and that is the wrap that clings to itself. So those are some basic bandages you're going to want on hand. Okay, prescription meds. So some ethical issues that I wanted to talk about. This is really... Yes, I know this is a survival type situation, but you really are going to have to be careful if you're going to use these. You're only going to use these if you really, really need to. This day and age, there are way too many antibiotics being prescribed for the common cold and viruses. It is really leading us into a bad situation in the next 10 to 15, 20 years. So a cold, a virus, 7 to 10 days. Unfortunately, a lot of people nowadays have no patience for symptoms. Really want to hold off on taking the antibiotic if you can. All right, that's just so important. So you got the sniffles, you got a cough. Very, very important to try to hold off as long as you can until you notice some symptoms where, hey, you know what, I've been holding on to this 101, 102 fever now for 7, 8 days. I feel a little short of breath. Then it's time, I'll go ahead and start the antibiotic in that type of a survival situation. If you're allergic to any meds, really important to know, there are some docs, some PAs, some NPs that are going to be willing to prescribe you meds if you tell them what you would like it for. There are a couple companies out there. One is Duration Health, and I'll list these in the description below. The other one is Jace, J-A-C-E, Medical, and those two companies you can call in. And Duration Health, I haven't talked with Jace directly, but Duration Health is extremely professional. You go through a lot of clicking the boxes. They want to know your primary care physician. You're going to have a Zoom meeting with a doc, and she's going to ask you some questions. So that's really, really nice. And what you're going to get from Duration Health is you're going to get this. Now, that is the bag that they're going to send you. And what they have in the bottom of this bag is they have diphenhydramine, your Benadryl. They're going to have some Tylenol. Prescription triamcinolone cream. It is a steroid cream, prescription, and definitely better than over-the-counter. And ofloxacin, this is an antibiotic eye drop. So those are really good for bacterial infections. Now let's talk about that before I go into the whole contents. So you should have a prescription eye drop on hand. And ofloxacin, the reason why they did that one is because, well, it's what we call broad spectrum. So that antibiotic eye drop is going to kill a variety of different bacteria. So that's why they have that. Normally, if someone comes in with a bacterial conjunctivitis, that is not the #1 eye drop I will go to. That is why this is in a survival type bag in a situation. So just so you're aware of that. And what they also send is they send in here a very nice little manual, field guide, and it goes through all of the meds through here. It tells you when you should use it, when you should not use it. It talks a little bit about being allergic. And then they have their 3 antibiotics, and a bottle of prednisone. So we're going to go through that. So what they have here is they have doxycycline, very good antibiotic for upper respiratory, sinuses, pneumonia. You can even use it for skin infections, so doxycycline. Word of caution, doxycycline, any of the cyclines, tetracycline, doxycycline, that is a medication that you do not want to use if it's expired. So expiration dates, all of these antibiotics, they're going to last about 5 years. I swear. I have a video on that. I'll put that at the end on expiration dates of antibiotics. But doxycycline, if you take that, you run a chance of getting a kidney disorder called Fanconi syndrome, and we won't dive into that. Just don't take doxy or any of the cyclines past their expiration date. Then they give you azithromycin, the classic Z-Pack, and that's the 2 tablets on day 1 tablet once a day for 4 days, and that is another one that's decent for upper respiratory tract infections, ear infections, although with children I haven't prescribed it for kids for ear infections in a rather long time because of resistance. So, but currently, azithromycin is the #1 drug for traveler's diarrhea these days. So it's nice to have that. Then Augmentin is the next one they give. It is really, really good for animal bites, good for sinuses, and actually it's the #1 drug of choice for cat bites, dog bites, and things of that nature. And then they give a bottle of 20 milligram tablets of the miracle drug prednisone, and prednisone is great for poison ivy. It's also one of the mainstays for severe asthma attacks, wheezing, joint pain, inflammation. It's the one that helps you live till you're 180. It does it all, right? So prednisone has been, so if you're an asthmatic, I'm sure you've been on prednisone in the past, but if you're an asthmatic, you want to have your inhalers on hand and you want to have your prednisone. So that's something you definitely want to have stocked up. Now, if you're a diabetic, you got to be really careful with that. It's going to jack up your sugar levels. So what would I recommend that Duration Health has not put in this bag? Well, they don't have ibuprofen in there, which I find interesting. They don't have that. They don't have an antifungal prescription strength cream. And as far as a broad spectrum antibiotic, they didn't have that in there, which I kind of applaud them for. A broad spectrum antibiotic would be a Levaquin. That was a quinolone in that topic of quinolone antibiotics, and they have that's Cipro, Levaquin, and those are not bad. They're really broad spectrum, but you got to be careful with those, like you got to be careful with any med. Important to note, in the Midwest, for example, there's a lot of cattle, especially out west. Farmers feed their cattle antibiotics. One of those is Cipro. Women who are getting urinary tract infections, we have seen a rise in meat-eating women and men that can slowly have a resistance to Cipro. So, little asterisk keynote there. So be aware of that. So below the waist, urinary tract infections, prostatitis, problems down below, Bactrim, Cipro, Macrobid. Those antibiotics are really good for urinary tract infections. And Bactrim and clindamycin are really good for like staph infections, MRSA. If you're allergic to penicillin, that's amoxicillin, penicillin, then you're going to have to defer to another medication. So you then want to be aware of that. Erythromycin, and you can take your cephalosporins. Cephalexin, Keflex, Ceftonir, those are going to be your alternatives, and it's important that you're very aware of that. The last thing you need in a survival situation is take a medication and have a friggin' allergic reaction to it. Now the problem, here's a double bind on the EpiPen situation. I would like to have an EpiPen. However, EpiPens will not last 5 years. So if anyone in the family has severe allergic reactions and you have kids, maybe you want an EpiPen Junior or an adult EpiPen, but it's not going to last 5 years, guys, about a year. That's about it on the EpiPen. Diabetics, insulin. That med you're going to have to refrigerate. So you got to have some ability to be able to do that. If the power goes down and the grid's down for a week or 2 weeks, not only will you have a hard time getting meds, you need some way of refrigerating that insulin, so that's important. Oh, what else can I tell you guys? So that's what I would do with prescription meds. I mean, that's what I would want to have. This bag is about $300. Jace, it's about $250. So it's about the same range. Is it worth it? I'm going to let you guys decide that. Some of you, it may be worth it for you, very much so. And some of you are saying, well, why don't you just prescribe them? It is unethical for me to prescribe meds to myself and my family. There's a reason for that. So that's why I have this in my hand. So important to note. That's why I have this. If I forgot, and I'm sure I forgot something, so if I did, put it down below. Do you have an experience? Do you have an allergic reaction to a med and not sure what you can go to? Have you been resistant to some of these meds and you're curious about what else you could use? Hey, throw those questions down below. I would love to hear from you. I'll try to answer it the best I can. If I don't know the answer, I guarantee you I will find the answer. All right, guys, I hope you found that helpful. I want you to know that Jace Medical and Duration Health, they did not sponsor me. So basically purchased this for this video, and I'm really hoping that you found it helpful and it gives you some direction on where to go with that. Hey, keep your eyes on the horizon, your face to the wind. Stay safe, stay healthy. Till next time, take care.